Well, public health has been transforming lives across the country for more than 150 years, adding decades to life expectancy, improving the quality of life for millions. And these successes, well, they didn't happen by chance. They're the result of dedicated community health workers, medical professionals, scientists, and advocates working together. And steps are still needed to build an even healthier future. Teresa Bird with UT Tyler's School of Health Professions is joining us live this morning to explain how we can all play a part, and that's the important part. We all can do that.
Yes.
So let's talk a little bit about that. We know that a healthy community, it doesn't just happen. It takes a coordinated effort. Who all is involved in this?
Well, really everyone is involved, and there are things that we as individuals can do to help our own health and the health of our community. And really, when we look at the causes of death in the United States, they're really, it's heart disease, cancer, stroke, that's been true for a long time. But really the actual causes of death are smoking, unhealthy eating, lack of physical activity, and excessive alcohol intake. That takes care of about 80% of all of those things.
Contributing factors to those diseases.
Those contributing factors. So not smoking, eating lots of fruits and vegetables and whole grains like your grandma told you, not drinking to excess, and getting a lot of physical activity are ways that we as individuals can help our own health, and we can help our neighbors, because when they see us doing those things, they might join in as well. But also, lots of different professions are involved in public health, not just public health professionals. So I like to talk about engineers, for instance, because the first public health things that happened were not, anything that had to do with medicine. It had to do with clean water, sewer systems. Those are the things that really made a difference in our lives, and having healthy food, clean food, access to food, which is a problem in some places. So there are lots of things that we can do as a community to improve our health.
And that's why you have to have everyone on board in this. So talk a little bit about how we can all get involved in this. You got a lot of things coming up. It's next week that this starts.
That's right.
So what can we do as a community to show our support and also contribute to being healthier?
Okay. Well, yeah, so National Public Health Week happens every year, and it's just a celebration really of public health. And so our first event is going to be Monday evening, and it starts at 6, and it's at the African American Museum. And that's going to be Mental Health Monday. And we're going to kick off National Public Health Week there. There's going to be a choir from Texas College. And then we're going to have a presentation about how to stay mentally healthy, because our mental health affects our physical health.
Absolutely.
And we think about health in public health as not just physical health, but mental, social, physical, and emotional health.
Stress, a contributing factor to so many diseases,
Stress,
right?
Yes, because almost all diseases are caused by inflammation, and stress increases our inflammation.
I know, if I go out for a walk or a run, immediately I feel 10 times better.
Absolutely. So that event's going to happen on Monday. Tuesday in the afternoon from 4 to 7, we have Fit City Tyler, which is going to be at the Rose Garden. We're going to have yoga. This is Net Health puts this on. We're going to have yoga, Pilates, and a walk with a doc through the Rose Garden, and there will be lots of people there talking, lots of booths where you can visit and find out more about health. You can get your blood pressure checked. There's going to be a lot of different events happening at that event. So we're really excited for that.
Always to be proactive. We are showing you a website right now. If you go to UT Tyler's website and you search Public Health Week, you too can find it and all the wonderful events that you're going to have, so that we can all work on our health together. And I think that support's important.
Yes, yes. And we'll have something happening every day of Public Health Week, and we'd love to see the public come out and support us. On Wednesday, we're going to have a cooking demonstration over at the building on the North Campus with one of our new nutritionists, so that will be
wonderful.
Kind of fun. Yeah.
Thanks so much for being with us, Teresa, and
Thank
educating
you.
us a little bit about how we can all make a difference. We'll be right back.